Hey everybody, this is Dr. Ron, and if you have Medicare, we have launched something called the Medicare COVID-19 Early Detection Program. And what it is utilizing technology to help us get to patients on a virtual platform. What does that mean in English? We want to know how you are, but we want to give you the tools to know how you are so we can interact with you as doctors, nurse practitioners, dietitians, and whatnot. So in this time of national crisis, we need to get this out as soon as possible. And so this is the actual plan. So we just had a power surge. So another power surge. So this is the Medicare COVID-19 Early Detection Program. And the problem is that the people who are healthy will ultimately get sick. So what's happening is right now is that as people are getting sick, they're going to the hospital, their doctor's office and stuff like that. You can come in a little closer. And what we want to do is we want to catch them early before they get truly sick in this stage right here, okay? And this is why we call the early detection program. And this is not just for COVID-19, this is for all medical issues. But in this time of crisis, we may be forced to shut down, and our generator is on for our building now. And so why are we doing this? Because normally what happens is someone who gets sick, they go to the doctor, and the doctor treats them, and they're just fine. However, what's happening right now is that the COVID-19 quarantines and the crisis is preventing that from happening. And so the people, especially the elderly, who are more susceptible to COVID-19 and the flu and everything else, cannot get to their doctor. And so that creates a massive problem. It creates a massive problem for me as a doctor. It creates a massive problem for everyone else as well. There's a solution for this. And the solution is that for those people, before they get sick, if they have tools to let us doctors know or first responders know that they're starting to get sick, we can attack it ahead of time and reach out to people. We have a computer algorithms that do that. So they would need blood pressure cuffs, we need to know their heart rate, oxygen saturation, temperature, and blood glucose. And all these are basically different devices and machines we can pick that up for. So we want to be able to ship one to you. And so whenever these machines, you're taking these machines, they're automatically synced to our platform. So we have monitors. And so when anyone's starting to get sick, we now have a trend. So we can see a high definition movie of what's going on in your health and not necessarily just a snapshot, okay? And so that's called the telehealth monitoring system. So who's in it? Doctors, nurse practitioners, health coaches, dietitians, and we can add a whole lot more people in here as the national crisis proceeds. And these people can all be on virtual platform, basically on demand. And so what happens is that these people determine, should the first responders come, like an ambulance or a paramedic, should go to the ER, should we do a direct hospital admission because you were truly sick? Should they go to their primary care? Should they stay at home? Should we do some medication adjustments? And these are all decisions that are made once we have the actual vital signs right here, and we can determine who goes to where and what. That's going to decrease people going to the ER. That's going to lighten up a lot of the load that are really being hit hard by the first responders, ER doctors, nurses, and all this stuff right now. So we need to use our resources wisely, and because we have the technology to do so, we need to start employing this. So how are we going to do that? So what we want to do, starting today, right now, if you are Medicare and you're healthy, I want you to come to our clinic so that we can see you and we can assess your entire bodily function, lung function, heart function, blood pressure, when you're healthy, so that whenever we give you the monitor and things starts going downhill, we now have a baseline to establish, hey, this is different from what you normally are, because everyone's blood pressure is different, everyone's heart rate and heart rate variability is different, everyone's lung function is different. And then once we're able to establish this, we plug you into the telehealth monitoring system, ship the kits to you, and then get you on a platform where you have access on either a tablet or a cell phone, where you can have access to our entire system. And this is what we're starting today. Thank you.